Hey, today we are going to go over our Unit 9, Foley catheter insertion. This is going to be another time of using our sail technique, and we will go over that. When you first come in the room, we want to make sure that you can again do your KWAPs first or confirm your orders, either one, but we want to make sure that we confirm our orders. We see that we've been ordered to put in a Foley today. We're going to do our skill overriders or KWAPs. I'm going to knock, introduce myself. I'm going to provide privacy, hand hygiene, and I've gathered my equipment here. I wanted two identifiers, can I have your name and date of birth, and check at 6842, and I've verified this on my bracelet. It wants us to explain some reasons why a Foley catheter would be placed. Urinary retention is one of those. People are unable to pee. Any kind of surgical procedures, people that go under, they'll put a catheter in, or sometimes end-of-life care, or measuring strict I's and O's, inputs and outputs. What is the difference between indwelling and a straight catheter? Indwelling is exactly what it says. It stays in there, it indwells inside the bladder. It's a tube, and that's what we'll be placing today's indwelling. A straight catheter is something that's temporary. You put it in, empty the bladder, and then you take it out. These can be done. Some patients will do this at home by themselves, and in an ER setting, we will do this for confused patients that are incontinent and we need a urine sample. When might you not be able to place a Foley? You may have difficulties with an enlarged prostate. That can become difficult as you're trying to place a catheter. Patients, whenever you pull back and you see maybe after a traumatic incident and you see blood at that urethral meatus, you're not going to want to stick a catheter because we don't know the extent of damage done inside the urethra. At this time, we would drape the patient with a bath blanket and position appropriately. We want to make sure that we're laying flat. I don't have a bath blanket with me, but I would put that on top here, making sure that I can keep my legs spread apart as needed. Making sure that we're covered. I would place a blanket over here to keep them warm, but we want to make sure that our things down here. I would want to put a waterproof pad, a little bit better than this one, but a waterproof pad under the buttocks, and then I'm going to perform peri-care with soap and water. We will have a towel and washcloth next week to perform that care. After washing, I'm going to take out my gloves, wash my hands, and I'm going to start setting up my sterile field. Many of you have already opened this by next week, but you will open this up. And some people like to use the bag as a trash can. It doesn't matter. If you look, you can see that the top is folded a very specific way. You want to make sure that our first pull here is, I'm going to make sure this is away from me. Then you're going to do both your sides. Make sure not to touch the inside. And then our last one is pulled towards us. If you open it backwards, and we have to pay attention to here, I'm reaching over my sterile field. Just make sure when we open kits like this, the last pull is towards us, and not, also don't want all this to happen. And remembering we're going to follow that we have an inch on the outside of this that we can touch and move this kit around with. I definitely don't want to turn my back on this kit. I don't want to reach over it. I don't want to do any of that. Sterile gloves will be on the top here. I would come down here, remembering I'm not going to open my sterile gloves over my kit. I would place my sterile gloves. Those don't fit me. I'm not going to put those on. But prior, you want to make sure that you expose it. I'm going to put on my sterile gloves. I want to get this, and you can lay this between the legs there. You'll have another one in here. That we want to put this on, and we can put that through there. These are not necessary, but they kind of help with the sterile field just a little bit. And again, I've got my sterile gloves on. I like to get the three things off the top of it: your lubricating jelly, our alcohol swabs, and our syringe. I don't want or need this. I would take that to the side. I want to open up my lubricating pack. I would put it down here. I'm going to open up my alcohol swabs, place it at the bottom here. The syringe is going to be attached to your Foley. You'll have it in a sheath like this. You want to be careful as you're taking it out. Some people will let it fall down. Just make sure that it doesn't hit your arm or any other surfaces. You'll connect the syringe here to this little port. You're not supposed to inflate the balloon before you stick it up, but I do like to show this is what happens when you inflate your balloon. This is what keeps the catheter inside of the patient. But you want to make sure that your syringe is attached before you insert the catheter. I will set this in the lubricant, and then I'm going to position my catheter in the box here. Now, I have got my everything that I need inside my kit. There's nothing else I need. With my sterile gloves, I will pick this up and I'm going to lay this down in the middle here. Because I have nothing else I can do with my sterile gloves, I will start cleaning my patient. You have 3 swabs in here. For a male, you're going to grab the penis, pull back the foreskin, and you're going to start with your swabs. Your first one, you're going to start at the tip and circle your way down, getting down towards the shaft. When you're done with this swab, being sure that we're not going to reach back over our field and ruin our sterile field. I'm going to clean swab till it's done. I'm just going to throw this to the floor or wherever to get it out of the way. I'm going to clean for a second one, clean, clean, clean. I'm tossing, and I'm going to clean again, and I'm throwing that out. Now, I've cleaned 3 times, and I want you to discuss why are we cleaning with swabs after we have just performed pericare. Soap and water is not going to kill all the germs. We're trying to get this as close as a germ-free zone as possible. That's why we use the extra cleaning. I want to grab my catheter here. It's already got lubricant on the tip, and I want to insert this into the penis. It may not fit. Yep. I am going to insert this. It's not going to fit right now, but until I see urine, you'll see urine flow into this tube here. Once I see that, I'm going to advance the catheter 1 to 2 more inches. When I get to that 1 to 2 more inches, I'm going to release my dirty hand, and I'm going to grab the catheter here. With my dominant hand, I'm going to inflate my balloon. After I inflate my balloon, I'm going to pull back to see if I can feel. And what you're doing here is you're feeling that the tube is inside the bladder. You feel it kind of bouncing in there. Then, after that, I would take and secure this to the patient's thigh there, probably with tape. And on the side of the bed rail, well, not bed rail, but you should have these little things here. They're non-movable of the bed. That's where we would hang our bag. You want to avoid using the side rails because those can cause tugging at the catheter and causing trauma to the bladder. Remove my gloves, wash my hands. I would put clean gloves on before I'd have done that. I've maintained my sterile field for the whole thing. I will cover the patient back up. I'm going to dispose of my supplies. I'm going to cover the patient back up, making sure we're in a comfortable position. I'm going to take off my gloves, wash my hands. And I want to document that I used sterile technique, and I want to describe how much urine that we got in the bag and the characteristics of the urine. And that would be it for that validation.